My mother read books to my sister and to me when we were little. And although I didn't know anything different, they were actually stories of Mother Teresa, Martin Luther King, Mahatma Gandhi as examples. So when I was thinking about today, I was thinking about my mother and maybe the influence that these early stories may have had on recognizing the importance of leadership. Even my mother would not have been able to predict that she would one day be watching her daughter try to navigate a global pandemic as a provincial Canadian public health person. But I wonder if this has not been almost as stressful for her in the last year as it has been for me. But I do believe she set the foundation and acted as a role model for me. As you all know, this has been an extremely challenging year, and we've all experienced firsthand the impacts of COVID-19. The pandemic has certainly affected everyone, but not everyone is affected equally. And we know that women have been faced with many additional challenges. And although women are still underrepresented in senior and decision-making roles, they have been in the spotlight throughout this pandemic, and that's across the world and in this country. Through collaboration, empathy, and evidence-based research, women around the world are leading their countries through the COVID-19 pandemic. Here in this country, when we look across this wonderful country, there are so many incredible women in health who are making an impact. And I certainly am proud to be part of the group of provincial medical officers of health and collaborating with inspiring women leaders across the country. And of course, on the front lines of healthcare delivery rate across the whole country. 7 of the 14 medical officers in Canada are women, and that includes Dr. Teresa Tam, our Chief Public Health Officer of Canada. We know that diversity in health leadership has a positive impact on population health. Women have and continue to play a key role in policy decisions related to families and communities, whether it's immunization, maternal child health, and breast and cervical screening. The pandemic has changed the way we see public health, and we can hope that young women will consider possibly a career in public service and in public health. I'm certainly delighted to think maybe I'll have had a little influence in shaping and inspiring some young girls to consider their careers in public health. The amount of support I have received has been overwhelming and extremely encouraging. I'm often asked how we have managed to keep the number of COVID cases relatively low in our province in PEI. And it's really only the commitment and collaboration of Islanders that has made us so successful. We have done extremely well over the last year by staying apart, even as we come together as an island. As a small and very connected province, one of our greatest assets is that we care about our neighbors, we look out for one another, and we keep each other safe. We have new and ongoing challenges, and we are learning more every day and continue to learn more every day about the pandemic. So as we go up to the 1-year mark, really, of the global pandemic, I know many of us are anxious to have family get-togethers and visits with our loved ones and do it in a different way than we've been doing for the last months. Individuals and families have marked important milestones during this pandemic: the birth of a child, the death of a loved one, life changes, such as moving into a care facility, marriages, birthdays, significant anniversaries, and graduations, to name just a few. So while COVID-19 has disrupted our lives and changed the way we mark these milestones, we can be grateful that the vaccination process has begun and that we can see the light at the end of what has seemed a very long tunnel. As we continue our journey with COVID-19, I ask that what I've asked Islanders every week for many months. Let us continue to be patient and let us continue to be kind. Thank you very much.